The Queen is going to be making an address to the nation later on, urging us to maintain our self-discipline and resolve. Just how important is that message going to be?
Well, I welcome the fact that Her Majesty will be making one of these very rare addresses because it recognises what an extraordinary and difficult time this is for the nation. And this point about holding our resolve is so important. The vast majority of people are following the public health advice, which is absolutely critical, and staying at home. But there are a small minority of people who are still not doing that. It's quite unbelievable, frankly, to see that there are some people who are not following the advice. But the vast and overwhelming majority of people are. And so I hope that Her Majesty will lift the spirits and also thank everybody who is doing the right thing by staying at home, because that is the best way to control the spread of this virus and the fastest way to get us out of this.
You say it's unbelievable that some people are breaking the rules of the lockdown, but I just wonder if you could clarify a little bit about what we are and we aren't allowed to do. The weather is very lovely this weekend. Not everyone has a garden. Is it acceptable to sit down in the park and sunbathe if you are maintaining social distancing?
We're absolutely clear that you should not leave your home unless it's for one of four reasons: for medical reasons, to buy food, to go to work if you can't work at home, or for exercise. And of course I understand how difficult this is, but the problem is that when you go out, it's not only that you might directly interact with somebody closer than 2 meters, it's also that whenever that you can spread the virus through touching something which somebody else then touches, or you could pick it up that way. So we're crystal clear in the guidance of what people should and shouldn't do. That guidance is backed up in law. It is not a request, it is a requirement in law, and people need to follow it. And I just say this to the very small minority, as you say, of people who are choosing to flout the guidance. You are putting others' lives at risk, and you're putting yourself in harm's way. And so we are very, very clear about that guidance. And
so does that mean, just to be crystal clear, that sunbathing is against the law?
Sunbathing is against the rules that have been set out for important public health reasons. I wish I didn't have to say this, but I do, because the whole country wants to come through this crisis. The whole country wants to come through this, of course, as quickly as possible. And the fastest way to come through the crisis and to save lives and to protect the NHS and reduce the pressure on the NHS, the fastest way to do that is to follow the guidance and to stay at home unless you've got one of the four reasons that we've set out.
You say the fastest way to effectively get out the lockdown is to follow the rules. Yesterday, Professor Neil Ferguson of Imperial College, advising the government, said that the restrictions could be eased in weeks if people follow the rules. Is that right?
Well, I'm not going to get into a conditional, if, because what matters is that people do follow the rules, and then we'll be able to make some progress. But there's only one message that's going to come out from the government over this, which is you really have to stay at home unless you have one of those four reasons. Stay at home because that then will slow the spread of the virus. So the scientists can do their analysis on what happens under different scenarios, but in a way that's second order, because we don't know how quickly the spread of this virus will stop, because it depends on how people behave. So every single person watching this programme can do their bit to get us out of this faster, and they do their bit by following the social distancing rules.
At the same time, though, lots of people will feel that they're making a big sacrifice here, particularly those people who live in overcrowded accommodation, those people who perhaps have mental health issues, those people who may not even feel safe at home. You have your advisor going on saying that it could be lifted in a matter of weeks. Surely you need to provide some clarity here on how long we could be in this situation for.
Well, I'd love to be able to provide even more clarity than we have. We were clear when those who've gone into shielding, those who are the most medically vulnerable, we would expect that to last at least 12 weeks. But the truth is, and one of the difficulties of this situation that we're all in, one of the difficulties is that there are uncertainties. And there are uncertainties because we're still learning information about the disease itself, and the science continues to improve. But there's also uncertainties as to how quickly we can stop the spread of this virus, because it does depend very directly on how people behave. There's a direct link from what proportion of people follow the rules through to the pressure on the NHS and how quickly we can reduce the pressure on the NHS, through to how many lives are lost and how quickly we can lift the very extraordinary measures. And I understand how impactful the measures are. Of course I do. And they impact people differently according to their circumstances. I get that. But this is why we need resolve as a nation, all to follow those rules, so that we can get out of it as fast as possible.
Okay. According to the Mail on Sunday, there's a bit of a battle or debate going on between yourself and the Chancellor about when to lift the lockdown. Perhaps understandably, you've got an eye on the NHS, he has an eye on the economy. Do you recognise that?
No. We're working very closely together, and what matters is that we can get out of this as fast as possible, and to do that we have to make sure that as many people as possible follow the rules, and so that we can slow the spread. So of course my job as Health Secretary is to build up the NHS and look out for the NHS and support the people in the NHS, in Public Health England and across the board who are working so hard to try to resolve this. I think that Rishi is doing an absolutely brilliant job as Chancellor. The measures that he's put in place to support businesses, to support people, self-employed people and employed people, are absolutely phenomenal. And in fact, he's been lauded around the world for the first-class economic response that we've got in this country. We all want to get through this as quickly as possible and and lift some of these extraordinary measures, but we can't do that until it's safe to do so.
OK, lots of praise for the Chancellor in the answer there. The big question, of course, is what is the government's long-term strategy for getting out of the lockdown?
Well, the first thing we have to do is flatten the curve and turn the curve of infections downwards. And we have seen some progress on that, but we're not there yet. And then once we've done that, we'll be able to think about the next steps, and we're doing the work on that. But we'll be able to set that out.
What are those next steps? Because this is the critical thing. What are the next steps? Is it a vaccine? Is it treatment? Is it testing? What is the way out?
Well, we're working on all of those three, and they're all very important. Treatments, to make sure that if we can improve the treatments, and if we can get the science behind the treatments better, then more people who become ill will be able to survive, and people will be less ill. A vaccine, of course, would be incredible, but it has to be safe and not do more harm than good. And it takes time to develop a vaccine like that. But in fact, the UK has put more funding into the global search for a vaccine than any other country around the world. And I'm working very closely with the DFID Secretary and the Foreign Secretary on that, because they've been leading that global search and put their budgets into that. And then, as well as obviously treatments and vaccines, testing matters as well. And we had a very big discussion about testing over the last week, and we have a clear strategy to increase the amount of testing.
Just want to ask about that testing, because many people say that that is one of the clearest ways out of the lockdown. You, of course, have set this aim to reach 100,000 tests a day by the end of April. But if you just look at the figures, at the minute, around 10,000 tests have been carried out a day. Just 11 days ago, Boris Johnson said that we'd have 250,000 tests a day, hopefully very soon. We're still stuck around 10,000. I mean, the numbers sound great. You want to believe them. But on this record, is that actually achievable?
Yes, it's going to be hard, and it's going to require an awful lot of people to put their shoulders to the wheel in the life sciences industry, across the NHS, and supported by the work that Public Health England has been doing brilliantly on expanding testing. We set a goal of 10,000 tests a day by the end of March, and we hit that goal. At the end of February, we had under 2,000 tests a day, so we are on a very rapid ramp up, but we clearly need to see that go further.
I mean, testing, of course, is crucial to get NHS staff back onto the front line, and I think there is still a bit of confusion about just how many NHS staff are currently off because of suspected coronavirus. The Royal College of Physicians surveyed their members, estimate that around 15% are off. What proportion of frontline NHS workers are off work?
It's about 8% on the latest figures, and that's the actual figure. The Royal College did do a survey, but it wasn't an accurate representation. So the 8% at the moment, but obviously we want to get that number down. So that's gone up since your
last press conference, then?
No, it's stable. At the press conference, I was asked the question about doctors. It's about 5.7% of doctors, 8% of NHS staff overall, and those figures are stable. But we want to get them down, obviously, and one of the ways that we do that is by getting the amount of testing for NHS staff up.
Another criticism as well has been on the amount of protective equipment on the front line. And I know you said that the available equipment is there, but there's been delays getting it through. There's been reports that the US has been intercepting some of the medical equipment bound for European countries. Are you concerned about some protectionism here?
Well, I'm very concerned that we keep open global supply chains, both for protective equipment and also for medicines, making sure that medicines can come in, because they're often made in several different countries on their journey from being raw chemicals through to the medicines that people take that save lives. And so we must be a beacon for the openness of those supply chains across the world. And make sure that we win that argument. It doesn't benefit anyone for all countries around the world to start putting up barriers. Now, at the same time, we have to recognise the reality of the challenges here and boost domestic production. So, for instance, I'm really proud of Burberry, who have switched their factories from making their top-end garb to making gowns for the NHS. I think that's absolutely fantastic. And in the same way that Formula One has switched from upgrading their amazing cars to making ventilators. So we are going to have more of a national effort domestically. But I also think we should be out there making the argument for countries around the world to be coming together and working together on this rather than putting in place barriers.
Now, both you and the Prime Minister tested positive for COVID-19. You're out and about, you're doing press conferences, you're doing interviews. Boris Johnson is still in self-isolation with a temperature. Just how ill is the Prime Minister?
Oh, he's okay. I've been talking to him every day, often several times a day throughout the time that both of us were off. So he's very much got his hand on the tiller. But he's still got a temperature. In a way, it shows, this virus affects different people differently. I was lucky. I had 2 pretty rough days, and then I bounced back. Some people do get it pretty mildly, and then for others, it's very, very serious. And the Prime Minister is not at that end of the spectrum. He's working away inside Downing Street, but he's protecting others by making sure that he too follows the clear public health advice, which is to self-isolate if you've got symptoms.
You can see why there is some concern about the health of the Prime Minister, though, at a time when he is still, of course, leading the response to what could be the biggest crisis since World War II. Doctors say that if a temperature persists for more than a week, more than 7 days, you could be at risk of developing pneumonia. Has he been visited by doctors?
I don't know, and even if I did, I wouldn't go into details in public. What I can say is that in dealing with him and working with him every day, he's in good spirits, but he's also being absolutely careful and cautious to follow public health advice, both for the direct impact and also as an example to the nation.
OK. Now, Labour has a new leader, Keir Starmer. He says he wants to work constructively with the government. Do you think we could ever see a government of national unity?
I don't think that's on the cards, but I do think that working together is important. I think that this is not a time when anybody wants to see political parties fighting between them. In fact, I've had a very constructive relationship with John Ashworth, the Shadow Health Secretary, who has, applied some constructive criticism, but it's been genuinely constructive, and that's been the tone in which he's done it is fine. And I think that what people want to see is their politicians coming together at this time of national crisis to try to solve the problem. Because frankly, all that matters is that we as a country get through this as well as we can, as fast as we can.